I was just filming a video and my phone went off and I said some words that I probably shouldn't say, be a blooper. Today I want to talk about the 4 different types of diabetes. Most people think there's only 2, type 1 and type 2. Type 1 is an autoimmune disease where your pancreas doesn't secrete insulin or doesn't secrete enough. So typically you're diagnosed as a kid. Not always, but typically. Then there's type 2, which most people think of when they think of diabetes, and they think of it a lifestyle type of disease. They think it's related to their weight. It's not. If you've watched any of my other videos, they think it's related to their age. It's not. If you've done any research or watched any of my other videos. Matter of fact, no disease is ever, you get the disease because you hit a certain age. That doesn't even pass the common sense test. And it doesn't have anything to do with genetics. So type 2 anyway. Type 3 is sugar brain, also known as Alzheimer's. That's type 3 diabetes. And then the 4th type is type 1.5, which is an autoimmune type disease, which means you have an autoimmune disease. Whether you know it or not doesn't mean that you do or don't have it, or you don't have it. It's autoimmune means it's genetic, means someone in your blood family has an autoimmune disease. Doesn't have to be the same one that you have. And that autoimmune disease is causing you a big issue in regulating of your blood sugar. Some of the most common autoimmune diseases that you might have heard of: multiple sclerosis, lupus, Raynaud's syndrome, Hashimoto's thyroiditis, Graves', ulcerative colitis, eczema, psoriasis. These are all different types of autoimmune diseases. And the thing about autoimmune diseases is they're genetic, like I said. So someone in your blood family has one, whether they know it or you know it, someone does. So, but you should be thinking, do I know of anyone in my blood family that had an autoimmune disease or has? Also, inability to get or stay pregnant is a good hint. If you're diabetic and you've had that issue, or maybe some female in your family. Usually it's a condition called PCOS, polycystic ovarian syndrome, when as a woman you have too much testosterone in your system. But if you are a type 1.5 diabetic and you don't know, how are you going to get better? If you have the wrong diagnosis, how do you get the right treatment plan? No one has ever been able to answer that question for me. So if you're interested to know what type of diabetic you might be, how to fix it and reverse it, do you have an autoimmune aspect, then you should give us a call to get some more information on this so we can help you. Listen, what do they call it? YOLO. You only live once. Get help if you need it, okay? 301-770-5395. We'd love to be able to help you and see if we can accept you as one of our 24 cases that we take per month. Okay, that's it for now.